In this video, we will be covering all the muscles that we had to learn in Muscle Part 1. So, if we look at the muscles of the face that we need to know, we have this muscle here. So it's that round one that goes around the eye. That is your orbicularis oculi. And that is going to be responsible for blinking. So closing the eye, that will be your orbicularis oculi. So that's this. Then you also have an orbicularis oris, which goes around the mouth. So orbicularis oris goes around the mouth. It allows the mouth to be closed and the lips to protrude in a kissing motion. Then you have these muscles here, your zygomaticus. So the zygomaticus runs from the zygomatic bone down to the angle of the mouth. And this is going to give us our smiling motion. So this is going to raise the angle of the mouth upward and make a smile. So that's all the muscles that you'll need to know for the face. So we need to know a couple muscles on the head, the muscles of mastication. So muscles here, this muscle is the temporalis. It attaches to the temporal bone and then down, further down to the coronoid process of the mandible. So it runs all the way from the temporal at the proximal attachment to the distal attachment at the coronoid process of the mandible. So the temporalis is responsible for elevating the mandible. The other muscle of mastication that you need to know is going to be your masseter. So your masseter is also responsible for elevating the mandible. It attaches to the zygomatic arch of the maxilla and runs down to the mandible, and when it contracts, it will elevate the mandible. So these are your muscles of mastication. Then we have some muscles in the anterior neck that you'll need to know. So you'll need to know the mylohyoid. So the mylohyoid is this one. It's going to be running from the mandible down to the hyoid bone, and it's going to elevate the hyoid and depress the mandible. It's found a little bit more laterally, and then the other muscle you'll need to know is found a little bit more medial, and that's the digastric. So your digastric muscle, you don't need to know the origin insertions. You just need to know that that also will elevate the hyoid bone and depress the mandible. So then if we look at the larger muscles of the neck, we have our sternocleidomastoid. So remember the sternocleidomastoid. One distal attachment will be the sternum, so that's here. Another distal attachment will be the clavicle. And then if you look up here, it wraps around towards the back to the mastoid process of the temporal bone. So that's what gives it its name, the sternocleidomastoid. So when I flex both sternocleidomastoids, so here this one and this one, so the right and the left, so when I flex both, it's going to pull the head downward. So it's going to flex the head downward. If I only flex one, so say I flex the left sternocleidomastoid, that will rotate the head towards the right. So it's going to rotate the head towards the right if I flex my left sternocleidomastoid. Then we also have some muscles that are located more posteriorly, the splenius, and that's going to also be there to move the head. So the splenius, when it contracts on both sides, so on this side and on the opposite side, it's going to cause the head to extend backwards. So down in this direction, the head will extend backwards. And then if you contract just one side, the splenius on one side, then you're going to see the head rotate on the same side that the splenius is contracting. So if the right splenius contracts, that means your head will rotate to the right. At the same time as your head rotates to the right, the left sternocleidomastoid will be contracting. So that's it for the neck muscles. What you do see in the area of the neck is the trapezius. So the trapezius comes all the way from the back and folds around anteriorly and attaches to the clavicle. So this portion right here, that's actually the trapezius. So one moment as I turn him around, we'll get to the back muscles. Okay, so we have our back muscles here. So the trapezius is the very large diamond-shaped muscle. So you can see it starts here, down here at the distal attachment. It runs all the way up to the scapula, goes forward to the clavicle anteriorly, all the way up along the neck and to the occipital. So it's on both sides. It's just on the left side here. It has been removed to be able to see the muscles just beneath it. So the trapezius is responsible for adducting, so adducting the scapula, and also depressing the scapula. And it along with the latissimus dorsi here are both the most superficial muscles of the back. So then if we remove the trapezius and we have deep to the trapezius, we have the rhomboid minor and the rhomboid major. So these are rhomboids. And then you have your levator scapulae. So your levator scapulae attaches to the medial border of the scapula, runs up to the cervical vertebrae, specifically the transverse processes. And so both the levator scapulae and the rhomboids are going to act to elevate the scapula. So that's going to give you your shrugging motion. Then we see our latissimus dorsi. So here we have the latissimus dorsi. It extends all the way down here to the sacral area, comes up along the lateral side of the body, and then its attachment site is actually on the humerus. So its actions will be on the arm, and that's what I called the waiter's tip. So it's going to adduct the arm, medially rotate it, and extend. So that's the action of the latissimus dorsi. So now we'll look at the muscles on the torso. Okay, so the muscles on the anterior torso, we have the rectus abdominis here, so that's the six-pack, and we know its proximal attachment is going to be the xiphoid process of the sternum, and it also attaches to the ribs proximally. So the rectus abdominis is what's responsible for flexing the torso. And then you have internal and external obliques. So you don't need to know which one's which, but just know them as abdominal obliques. So you can see them on this side and also on this side. They're on either side of the abdomen, and they're going to flex and rotate the abdomen or the torso. Then we also have the pectoralis major. So that's the most superficial one here on the chest. And it's going to attach superiorly here to the clavicle, medially to the sternum, and then over here laterally to the greater tubercle of the humerus. So the pec major is responsible for adducting, so adducting the arms. So that's going to be specifically the arm, not the forearm, it's adducting, bringing the arms closer to the midline. So that's the pec major. Your pec minor, that one's going to be if you lift off the pec major, deep to the pec major is your pectoralis minor. So that's this one here. And so the pectoralis minor, it's running from that coracoid process of the scapula down to the ribs, and it's going to be responsible for elevating the ribs during inhalation, as well as abducting, so abducting the scapula. Another muscle that's going to abduct the scapula is our serratus anterior. So the serratus anterior is this muscle that has a serrated appearance, and it's running down the side of the ribs. So this is your serratus anterior, and that's also going to abduct the scapula. So that's it for all of the torso. Now we're going to go to the muscles of the arm. Okay, so this is not an anatomical position because, as you can see, the arm is pronated. So, but you need to have it viewed this way in order to see the deltoid. So here is your deltoid. The deltoid will attach proximally to the clavicle and to the acromion process. So here's the clavicle and then the acromion process of the scapula. So distally it attaches to the deltoid tuberosity of the humerus, and the deltoid acts to abduct the arm. So that's abduct the arm. Then, if you put the arm into anatomical position, you're able to see the other muscles that we've learned. So here we see the biceps brachii. So we know, I'm going to remove this deltoid here so we can see where the attachment points are. So the biceps brachii, that's going to be attaching at the coracoid process of the scapula. And then also, we have another belly over here that's going to be attaching somewhere else, but you don't need to know that. So it's just the tubercle of the humerus, the glenoid tubercle. So it has two attachments, and you just need to know the coracoid process of the scapula. So it runs down the length of the arm, it crosses the elbow joint. And if we remove this one here, let's see, oh no, we're not going to be able to see it, but it's going to come and attach distally to the radial tuberosity. So that was the little bump just after the head of the radius. So it comes down, attaches to the radial tuberosity. So you should expect then, if you follow this down, you should hit the thumb, and we do. So we know that the biceps brachii is a little bit, it's medial, but also a little bit lateral because it's coming down towards the radius. So then if we remove the biceps brachii, we see a nice picture of the brachialis. So remember, the biceps brachii does most of your flexion of the forearm, so it does the flexion at the elbow while in a supine position, so while in anatomical position. Whereas in a pronated position, it's going to be the brachialis that's doing most of your flexion. So this is your brachialis. Then we have so the brachialis and the biceps brachii are considered, the biceps brachii are considered flexor muscles. So they're in the anterior compartment, and they're known as flexors. If you look down at the forearm, all the muscles in the forearm are also considered flexors. So then we'll look to the posterior compartment, And all of these muscles are considered extensors. So the anterior and posterior compartments, they are all going to be antagonist of one another. So they're going to do the opposite. Biceps brachii will flex, triceps brachii will extend. So here you have the triceps brachii, and that's going to attach at the scapula and the humerus and then run down to the olecranon process of the ulna. So that's your triceps brachii, and that's going to extend the arm. And that completes all of the muscles that you need to know for muscle part 1.